evening.
Do you have a statement?
I do.
Or a statement?
Thank you. I'm Eduardo Vega, Executive Director with the Mental Health Association of San Francisco. We've been really positive about our involvement with San Francisco Police Department on the development of the CIT project. That's been ongoing. It's been very important for this community as a way of not just healing, but coming forward with good process and good recommendations for preventing violent interactions between law enforcement and people with mental illness. The CIT project is very essential to getting where we need to go as a community, but it is about providing tools. CIT, Crisis Intervention Team, is about tools for interacting successfully with people who are experiencing psychiatric crisis. Weapons are not tools, and this is why we're, in a certain sense, really dismayed that Tasers have entered into the conversation specifically about CIT. So we have a position statement here, and probably most of you have seen it. The Mental Health Association of San Francisco is opposed to the use of Tasers, most in particular with regards to people with psychiatric disabilities or mental illness. The issue of whether Tasers become used by San Francisco Police Department is broader than the CIT program. And our big concern is that by bringing the focus of this issue onto specifically people with psychiatric disabilities who are among the most fragile and most likely to be endangered through use of an electronic control weapon, we're really pushing this conversation in exactly the wrong direction. CIT should be provided the team members who have been trained and understand the principles. Like many of us who have been active in the mental health field for dozens of years, we know that even in the presence of a weapon, even in the presence of somebody who's really exacerbated, the right skills, the right tools, and the right people can bring a positive, productive solution to the fore. Use of Tasers is not something we support because of the danger it represents specifically to people who are on psychotropic medications and who may otherwise be endangered as well. In addition, we're concerned that bringing this focus applies a double standard and actually targets people who are of a protected class, potentially, under the Americans with Disabilities Act. For 2 years, before they were enjoined to stop the program, sued by the Department of Justice, and then enjoined the department to develop completely different procedures and to suspend the use of Tasers in the case of people with